This video is for anyone who wants to learn more about interstitial cystitis, or maybe you have a friend or family member who was recently diagnosed and you are interested in learning more about this condition. I'm Callie. I've had IC my entire life, and I now am one of the only interstitial cystitis dietitians in the world. So I work with IC warriors, as we call ourselves, every single day. And I know exactly, firsthand what people with IC go through, but I also know the struggles of other IC warriors that I may not struggle with. So I wanted to run through some of the basics and then tell you a bit more about what to expect and how you can support whoever it is in your life that is struggling with interstitial cystitis. So interstitial cystitis, or IC, is a bladder condition that affects millions of women and men around the world. You probably, if you've never heard of it, it's probably because it affects the bladder, and that's a bit of a taboo topic for many people. So they may not be comfortable sharing with you or bringing it up. And unfortunately, that is all too common and doesn't help raise awareness for this condition. So my goal over the next few years is to help open up this conversation and to raise awareness. So you can help us in doing that, and you're already on the right journey by watching this video. So interstitial cystitis essentially mimics a UTI, a urinary tract infection, but the difference is a UTI, there will be a bacterial infection when you get your urine checked. And with IC, there will be no infection present. So symptoms can include frequency or having to pee a lot, urgency, feeling like you have to pee a lot, but maybe only a few drops come out, pain before, during, or after urination, pain with sex, pelvic pain, pelvic pressure. Some people report bloating in their abdomen. So these symptoms are not comfortable, and a lot of us have some pretty brutal pain that we deal with. Symptoms can be constant. They can come and go. We can have a flare-up, which basically means an increase in our symptoms. So your loved one may look fine one day, and then the next day they may be bedridden. Just because we look okay or we look healthy on the outside doesn't mean that we are okay on the inside or that we're not hurting. And that's why IC is considered an invisible illness. So we reviewed the symptoms. So the diagnostic process, it typically involves meeting with a urologist or a urogynecologist if the person is female, and the doctor may want to run some tests because IC is a diagnosis of exclusion, meaning your doctor is going to want to rule all other explanations for your symptoms out. So they're going to want to rule out any sort of like tumor or, God forbid, cancer or some sort of other health condition that could be occurring, maybe endometriosis on the bladder wall. Anything like that. So they may have someone do testing. They may want to do a cystoscopy, which is looking at the bladder wall. It's a scope of that. That can be done awake or under anesthesia. So that is a procedure that is fairly common among the diagnostic process in the United States. In terms of treatment, so IC has no known cause or cure at this point in time. However, symptoms can be managed. There's a variety of different treatment options. Some are invasive options. Some are non-invasive options. There's a procedure or treatment option available called instillations, which is where the doctor or nurse will put liquid medication into the bladder through the urethra, so it's not comfortable. There's a procedure called a hydrodistension where they essentially stretch out your bladder with some fluid. There's a couple other more invasive options. There's medications. There's only one FDA approved medication, but unfortunately there are some reports of eye damage with this. So a lot of doctors are hesitant to prescribe this medication to their patients. There's other medications that people could try, like antidepressants, antihistamines, but there's no one medication that works for everybody, and these medications can come with risky side effects, as most medications do. There are some supplements that can be tried. There are, in terms of non-invasive treatment options, so pelvic floor physical therapy is a highly recommended treatment option by doctors for people suffering from pelvic floor dysfunction, which is a dysfunction of the nerves, or not the nerves, sorry, the muscles in the bladder. Seems to be very helpful among people with IC and pelvic floor dysfunction. So a doctor may also recommend making some diet changes, and that is a hard pill to swallow for a lot of people. They are handed a list of foods that they can no longer eat. So think everything fun that you can consume: alcohol, coffee, certain teas, caffeinated anything, carbonated beverages, tomatoes, citrus, chocolate, soy, artificial sweeteners. You know, the list goes on. And for many of us, that is a devastating moment, knowing that the foods and beverages that you love, you could potentially not be able to tolerate anymore. So your loved one may feel some negative feelings about this. They may struggle with this. As an IC dietitian, I recommend doing an elimination diet to learn if you are diet sensitive. So if you are interested in learning more about that, follow me on my social media accounts. I have a ton of information. But getting the diagnosis that, okay, yes, it's great that you can put a name to what I'm feeling. That's great, because a lot of us feel crazy for so long when doctors aren't finding anything, but it can be overwhelming to learn that you have an illness that doesn't have a cure, or that researchers don't really know about, or that we ourselves have never heard of before. It can be really confusing. There's lots of varying advice on the internet. There are support groups on Facebook that people can join, but these groups can get really negative and aren't the best place for somebody in a fragile mental state. So it can be a really isolating condition, especially if you do have to do these invasive treatments or change your diet. Like, our lives change so much. You may not even notice it, but a lot of people are terrified to eat. They're terrified to do anything that could trigger their symptoms. Maybe that's exercising. Maybe that's being in a car for a long time. Maybe it is, I don't know, eating their favorite food. It's parts of like a normal daily life where you get all of that taken from you. You're going to feel a lot of different emotions, and that can be really tough to deal with, especially if you have no one in your life to talk to. So I'm hoping that this video will help you understand what we're going through so that you can support the person in your life with IC, or if you ever come in contact with someone with IC in the future, that you can help them or help support them and ask, how can I help you? Because if we have to eat a certain way, and maybe it's a mom and they have to cook for their family, but their kids don't want to eat what they're eating, or their spouse doesn't want to eat what they have to eat, that's kind of bland. It can really become frustrating in addition to isolating. It can really get in the way of physical intimacy. Okay? That can be painful for us. That can be a really triggering event. And so for a lot of partners, this can be a really tough thing. Or if someone's single, entering the dating world can be really overwhelming and hard to navigate. So, also going out to eat is a really daunting task because there could be some sort of hidden ingredient that isn't on the menu in whatever dish someone orders. Or a person with IC may be concerned that the people they went to dinner with are going to think that they're annoying, or they're asking too many questions to the waiter, or the waiter's going to get angry at them for asking so much, or the chef is going to get irritated or offended somehow. There's a lot of mental hurdles that we go through, and many of us are highly sensitive people. We're perfectionists, we're people pleasers, so we will internalize our feelings. We may not speak about them to anyone, but this condition can be so isolating and just so lonely. So my hope is that this video helps you to understand, what we're feeling, but in terms of how you can help, ask the person in your life with IC, how can I support you? Is there something that you need today? Is there an IC friendly dish that we can make together so that we can both eat it? Do you want someone to go to your appointment with you? Do you, I don't know. I ran out of ideas. But ask. And you just learning about it is a really, really great first step. So I'm hoping to expand on this. And if you have any questions, drop them in the comments.